Dr. Anand Krishnan is professor in Center for Community Medicine, AIIMS New Delhi, and has a wide variety interest in different aspects of public health. He is a keen researcher and has led many successful collaborative research projects with WHO, ICMR, CDS USA, and has more than 300 publications. He heads the WHO Collaborative Development and Research in Community-Based NCD Prevention and Control. He has worked as international consultant for drafting of the National NCD Prevention and Control Strategy and provided technical assistance for national NCD risk factor surveys to many SEAR countries. He is a member of WHO Task Force for Evaluate Influence Data to Vaccine Impact and Economic Modeling, WHO Working Group on Influenza Burden Estimation, member WHO UNDESA Technical Advisory Group on COVID Mortality Estimation.
Okay, welcome participants. Now I am going to discuss about diseases of water and what public health challenges do they pose, especially in India. I would be covering water-related disease burden, some interventions related to promote water prevention of water diseases, equity issues in water and health, how sustainable development goals have included water, and some India-specific challenges. First of all, just to trying to understand what is a public health challenge. Any disease or group of diseases can be considered as a public health challenge if they pose a significant disease burden, and we will discuss this disease burden subsequently. So if they cause a major amount of mortality and morbidity. Number two, they are generally avoidable so that there are some interventions which are possible against these diseases. And they also result in inequities, both inequities in the sense that the disease itself causes inequities, or the disease occurs more in a certain group of people and less in other group of people. If all these three criteria are met, generally we can make a good case for policymakers to do something about this and get them to arrive at a consensus and recognize that this is a problem that needs to be addressed by a public health approach. Starting with disease burden. When we talk of disease burden, we generally include mortality, morbidity, and economic impact. Mortality means number of people who are dying due to the disease, and or proportion of deaths which can be attributed to the particular cause. When we say morbidity, typically we mean number of cases who suffer from that particular disease. However, it sometimes becomes difficult to use that for comparison, as it would be not appropriate to compare, let's say, number of people with diarrhea with number of people with cancer. Obviously, the morbidity is much higher with cancer and much less with diarrhea. So we need to look at an indicator which can make this distinction. And the one that we commonly use is what is called as a disability adjusted life years. Disability adjusted life years has two components, and I will explain it more in my next slide. Comparing of potential years of life lost, or YLL, which occurs because of early death of the disease, or years lived with disability. For example, cancer patients lives with disability, so he is not fully healthy and therefore has lost a certain amount of life because of the disability. So one disability adjusted life years, or DALY, can be thought of as one lost year of healthy life. We can always convert disease, both mortality and morbidity, into economic terms in terms of cost which are lost because of treatment of the disease, as well as because of loss of productivity of the disease, which together would form the economic burden of any disease. Trying to understand DALY a little bit better, if you look at this diagram, which is a square, let's say that there are 100 people who can optimally live up to 100 years. So that covers the whole square. The rectangle is entirely covered by that area of 100 people living 100 years of life. However, we know that in reality that does not happen. People die at various age groups. So as you can see in the upper line, which indicates premature mortality, and in the upper part of the rectangle between the upper and the right-sided lines, and this indicates the years lost due to premature death. Whereas even those who live they generally do not live with full life. And therefore we lose sometimes some years due to disability. And that would be the area between these two lines. And all the area which is above A is the area which has been lost due to disability. So that's how we calculate DALI, because I might be addressing groups of people who do not understand DALI. DALI enables us to compare mortality and morbidity together, and also different types of morbidities. That's the greatest advantage of DALI. However, when we are talking of unsafe water, obviously unsafe water is not a disease, but it is a risk for disease. And we'll come to what are the diseases which are attributable to unsafe water. So health risks are, so we use the term risk factors, which is defined as any attribute, characteristics or exposure that increases the likelihood of a person developing a disease or dying or having an injury. Some of the common known risk factors are, we know tobacco is a risk factor, or alcohol consumption is a risk factor. Similarly, drinking unsafe water is a risk factor. And you can see that almost, if you look at diarrhea as a disease, almost 70% of diarrhea can be attributed to unsafe water. There are other causes for it, like hand washing or unsafe sanitation, which means lack of toilets. Definitely, unsafe water is an important contributor for various diseases. And what are the diseases which can be related to water? You will see the term used is water-related diseases. The commonest one that we use is what are called as water-borne diseases, which is what we said typically something which goes with ingesting the water. And if the pathogen is present in the water, if we drink that water, we will get the disease, which is largely diseases of gastrointestinal system, of diarrheas, cholera, worm infestation, typhoid, hepatitis A, shigellosis, and those kind of diseases. These are the commonest group of diseases which we include when we say water-related diseases. There are other diseases, for example, water wash diseases, or these diseases are more common in areas where there is water shortage, because people are not able to wash themselves or their hands much better. Water-based diseases are those where water plays a role in the life cycle of the agent, like schistosomiasis or Guinea worm. And finally, water-related is obviously many of these malaria, dengue, and mosquito-related diseases have a strong correlation with the presence of water. So these are the different diseases which can be caused by water. Along with that, recurrent diarrhea is itself an important cause of childhood malnutrition. And one of the important interventions for childhood malnutrition is to prevent recurrent diarrhea in children. So if you look at global burden, you can see in this diagram, again, the global burden of diseases. This is estimated death rate attributed to unsafe water. And you can see in India comes at sometimes somewhere between 50 to 75 per 100,000 individuals. Somewhere along the middle of the spectrum. Obviously, the disease burden is much higher in African countries. But India is also not among better performing countries in terms of deaths due to diseases caused by unsafe water. So if you look at important risk factors, and if you have to prioritize risk factors for India, which again GBD does based on the DALIs for each of the risk factors, you will see that unsafe safe water comes at number 7. It is there before by child malnutrition. Again, as I said, diarrhea also indirectly water is attributable for that. Air pollution, dietary factors, blood pressure, raised plasma glucose, and tobacco use are the factors which are above unsafe water. This unsafe water was number 2 in 1990 and has now come down to number 7. So obviously, either we are improving here or we are worsening in other risk factors. But important to note that the person per disease burden due to unsafe water is much higher in India as compared to China. So definitely, as a risk factor, unsafe water is something that public health people should be interested in addressing. The same thing GBD in terms of DALI for all the diseases is shown here. You can see that diarrhea, typhoid, paratyphoid, and all the diseases that we talked of is comprising about 5 to 10% of all the disease of the total rectangle that you see. Diarrhea is among the biggest square, as you can see, other being ischemic heart disease or neonatal or COPD. Diarrhea comes almost after these three things. So diarrhea is an important cause of mortality in India, and we will see it by this. You can see that if you look at infectious causes, diarrhea is actually the most important infectious disease cause of death in India. Tuberculosis is number 2, and then is and respiratory infections and pneumonia are also equal, followed by HIV and AIDS. Yet we know that the focus on diarrhea is much lesser than whether it is tuberculosis or HIV/AIDS. People very often don't talk about diarrhea, but talk more about tuberculosis and HIV/AIDS. That's something that we should do something about. Again, you can see that malaria is in this diagram on the right. The horizontal bar graphs tell you that the diarrhea almost it causes 20 years of life lost and million years of life and 2 million years of life disability. We can see that it is more years of life lost is more because most of the diarrheal deaths occur in childhood, and therefore it causes more of death and less of disability because it is also an acute disease. And therefore the disability, even severe, will be only for a short period of time and therefore will not contribute much to years lived with disability. So what can we do about preventing water-related diseases? To understand that, what we often use what is called as an F diagram. Almost all causes of diarrhea which we discussed, obviously water-borne diseases, are because there is a fecal contamination of drinking water. And fecal feces have a lot of pathogenic bacteria, and that when it enters our food pipe or our system, that leads to a lot of infections. And that can happen through fluids, including water, fields, especially if you are going to in farmers or in rural areas, flies when they sit on feces and then come and sit on our food, and finally fingers, especially after if defecation, we don't wash our hands, or after dirtying with the soil, we don't wash our hands. So this automatically also tells us what we can do to prevent these diseases. One of the biggest way is what we call as a sanitation barrier is to build more toilets. And that's why we often use water supply and sanitation in a single term called as a WASH interventions. Water supply, sanitation, and hand hygiene interventions. Because these together, three things together are the most important interventions for water-related diseases. So having a sanitation barrier by building toilets, people do not defecate in the open, but they use toilets for defecation. Improving water quality at the source, at the supply, and also at home. Increasing water quantity, because we also saw that lack of access to water itself results in less hand washing and other kinds of diseases. And promoting hand washing. And the panel on the right tells you the impact of these interventions. As you can see, more distal the intervention, distal means more closer to feces, less effective would be the intervention. More proximal, or one which is closer to the host, as you can see, hand washing, more effective because they are occurring at the time where you are going to likely to be infected. So those kind of interventions generally show much better effectiveness and are also more cost effective. However, they are not very sustainable because hand washing will need to be done forever. But as we improve sanitation and improve water supply, these are sort of permanent or semi-permanent interventions, which are one-time interventions and do not require repeated reinforcement. So we need to mix up both these kind of sustainable interventions, which look at sanitation and water quality, as well as point of use interventions like point of use water treatment or chlorination or use of ROs, along with hand washing. These two sets of intervention can help us prevent water-related diseases. So if you look at access to water, this is data from NFHS 5, which is not yet complete in all the states, but it does show that there are water-related challenges. In this, we are covering the Northeast. There seems to be challenges, but some of the Central Indian states we know also have serious water access issues, like Vidarbha region. So are WASH interventions cost effective, which means that the amount of money which is invested in making these interventions available to population, do we have a return of investment? And it is generally said that most of the water interventions, the return of investment is quite high. And we can look at the tables shown here, which shows that for every Dali, which is, as we said, disability assisted life year saved due to the intervention, the cost is only $94. We definitely would rate a 1 year of a person's life at much higher than $94, or for that matter, $223. So all of these interventions are highly cost effective, and there's definitely a strong economic case for investing in improving water supply and sanitation. We also know that water-related diseases are important in dealing with disasters and emergencies, because at that time there is access to clean and water is always questionable. However, we do not have too many very effective interventions. The evidence review shows that disinfection of wells, if they're available, source-based treatment and use of chlorine and hand washing are the most moderately effective in preventing water-related diseases. But many of the interventions like water taking, well rehabilitation, bucket of chlorination, household spraying, hand washing alone, they may not be very effective in preventing diseases during disasters and emergencies. So as I said, one of the issues lens which we look at in any public health issue is the lens of equity. So is water supply or water access to water an equity issue? The slide or the panel on the right side shows you some countries, India is not there, where we can see that people have to pay for getting enough water for their homes. And this is up to, if you can see in many of these countries, it goes up to over 5%. And definitely many of them are paying more than 2% of their total expenditure for a month on water. So the question is water a human right, or should we treat it like a service or a marketable goods which needs to be transferred from a producer to a consumer? So how do we look at this issue? And access is also a rural-urban issue. We know that there are a lot of issues, access to water in many parts of India, especially rural India, whereas urban India has much better access, mainly because of piped water supply. There are also gender issues in water. Largely in the Indian cultural context, women have the key role in provision, management, and safeguarding of water. They spend their time in acquiring water than men and boys. And water collection is a heavy task. And it also exposes women and girls to threats of violence and health hazards when they have to travel a long distance to collect the water. This also affects children attending their schools. And also it deprives women to contribute to their families in other ways, including agriculture production or food security, or even partaking in the business. And therefore, access to clean water is also a gender issue. And to promote gender equity, we need to make water easily accessible to families. Okay, as this study shows, the houses in the Mumbai slum were paying much more than what the government was charging for water, and almost paying about their, even in the best of the times like winter and rainy season, about 6% of their household expenditure on water, and during summer seasons, it went up to 16%, which is very high and clearly unacceptable for a basic necessity of life. And despite this, they were not having adequate water. As you can see, that households using less than 50 liters of water were about 20%, and almost 10% were using less than 20 liters per capita per day. The usual guidelines for water is about 135 liters per capita per day. So clearly, despite paying so much, they are not getting adequate amount of water. And also the study found that a lot of the point of source for water samples were contaminated. Even within their house, the stored drinking water is contaminated because they were not storing it properly. So clearly a scenario where water-related diseases burden are going to be very high due to both access and quality issues. So the question is water a public good? If in general, in public health parlance, if something is a public good, the government should invest itself on it. And a private good should be allowed to be dealt with by market forces. Public good has two key properties. One is non-rivalry in consumption, and second is non-excludability, and what we also call as externality. Non-rivalry in consumption means that if somebody takes that particular good, other person's amount is not affected. The best example is a street light. If my use of street light does not impact upon anybody else's use of street light. Similarly for the sewage system. However, if this is not possible, therefore if non-rivalry is there, you cannot allow markets to function, because rivalry is a key feature for market systems. Similarly, if with public goods, if good is available for consumption by anybody, it is available for all. It is physically not possible to exclude any person from consuming the good. So in general, people have treated water both as a public good and as a private good. When water is left in situ for navigation, for people, for enjoy, for recreation or aquatic habit, it is good. However, water consumption at home is largely treated as a private good, and that is what is resulting in a lot of inequities. And it is time that we consider water use at home. It is only a rivalry because there is a shortage of water. If there was enough water, the use of water would not be fulfill the criteria of rivalry. These have implications for economics and marketing and pricing of water. So should water be given free, or should what people be charging for water? If yes, what should be the charge of water? Globally, water is treated as a public good, and sustainable development goals, if you can see, there are 17 sustainable development goals which address different aspects of our life. Obviously, health is there, which is number 3. But today we are talking about number 6, which is clean water and sanitation. Sustainable Development Goal 6 talks about ensuring availability and sustainable management of water and sanitation for all. It includes drinking water, sanitation and hygiene, water quality, water use efficiency, water resource management, as well as larger water ecosystems. It's something that governments across the globe are monitoring very closely. How many people remain without basic drinking water? And you can see that it is 785 million globally. 1 out of 4 healthcare facilities lack basic drinking water services. So you can see that globally, water access, availability, and quality continues to be a challenge. If you look at India-specific issues, we know contamination of water in the distribution system. Our water supply systems are quite old in many cities, and they get contaminated. We also have growing water scarcity. A lot of underground groundwater recharge is not happening, resulting in people need to digging more borewells, much deeper. And if this continues, we are going to end up in a serious water scarcity. Implementing innovative low-cost sanitation system. There have been many recent initiatives which have addressed these issues, including the Swachh Bharat mission, but we still need to make a significant impact on improving sanitation, especially in rural areas. Providing sustainable water supplies and sanitation in urban and semi-urban areas and slums, as we see, is an important challenge. We need to address inequities and ultimately look at management of water resources to ensure sustainability. So in conclusion, water-related disease continue to cause significant avoidable disease burden, both globally and in India. This disease burden is borne more by the poor and the most vulnerable segments of the population. It also continues to pose a challenge during disasters and other public health emergencies. Access to safe water is a human rights issue. There are a lot of effective interventions which are now available to address this problem, and we need to have a global and national commitment and ensure that the investments are done to achieve these goals. Thank you.